The month of June is Youth Month, and there's been lots of focus on matters affecting the youth. Now, as the month draws to a close, we are reminded of the main health issues facing youth today. One of the major ones is the problem of the increasing incidence of HIV, especially amongst young girls between the ages of 15 and 25. Of course, this looks for renewed looks into prevention, HIV prevention campaigns, I should say. Whereas condom usage has been widely promoted, disturbing reports show that only 52% of youth used condoms in the last year. The South African Deputy President Cyril Ramaphosa yesterday launched the National HIV Prevention Campaign for young women. This is a 3-year multi-sectorial campaign that seeks to decrease the infection rates in these young girls and women. The campaign will not only focus on the young females, it will also include all other members of society, including males. Now, one of the prevention strategies for female to male HIV transmission is through male circumcision. Now, there are mainly two ways in which our youth get circumcised these days. The one is as part of the traditional practice of rite of passage into manhood. And incidentally, schools have just closed for the winter break, and for some, this is the time when young boys head to the mountains for this traditional practice. The problem, though, that we've witnessed over the years is that some of these youngsters end up with major complications that include sepsis, bleeding, and sadly death in some instances. Now, the other is, of course, the so-called male medical circumcision. So today we examine the subject of male circumcision. We look at how circumcision can contribute to HIV prevention strategies and how best we can achieve the balance between maintaining our cultural practices and traditions on the one hand and achieving safer circumcision outcomes for our young men on the other side. Now, our guests today include the South African Deputy Minister of Traditional Affairs, the Director of the National MMC Program from the National Department of Health, an MMC surgeon, and a Gauteng Regional MMC Director from CareWorks, and a young man who successfully underwent MMC to share his experiences with us. So sit back, relax, and learn from this exciting show ahead. Be part of this show by calling us with your questions or views on Johannesburg 714-6841, 6842, or 6843, or interact with us on our Facebook page, SABC Health Talk, and on Twitter at SABC Health Talk. I'm Dr. Cyril Ramaphosa, and this is Health Talk.
Male circumcision is a widely accepted practice in South Africa, a diverse country rich with multiple cultural and religious beliefs. However, citizens have mixed reactions over the two methods of circumcision, traditional and medical.
I'd prefer having medical circumcision because for me it's the easiest and it's actually painless because you just need an injection. That's the only part that hurts. Then the traditional, for me, it's kind of a long thing because it's a hack, because you don't get like medical help when you feel the pain and things like that.
Apparently, like, the people die up in the hills and the mountains and stuff, so that's kind of bad. You can't really like go circumcised and die because of circumcision. That's kind of pointless. So that's why I choose medical.
I think medical, because medical's a bit more safer than traditional. Like, there are less risk of you getting hurt and infections with the medical compared to the traditional. And it's done by the medical doctor that knows what they are doing.
I would say traditional. Yeah, because traditional is where we come from. You understand? But either way, I know some of the people, they say medical, because due to the people that are dying.
Medical, right? Because it's more safe, the wound is being taken care of, and doctors to actually be around you 24/7, or even at home you have people taking care of you, unlike being there in the mountain having to prove that you're a man, while incurring more risk of your wound being contaminated.
Besides circumcision being an effective HIV prevention measure, there are numerous other benefits linked to circumcision.
It's more hygienic, less STI transmittal, and it's more safe than as you're not circumcised.
It's more hygienic, better sexual performance, and it's just safer. Can prevent from other diseases.
I think as for medical doctors who are trained to do it, it lessens the risk of infections and death. So if people are going to go the traditional way, I think those traditional doctors that do circumcision need to have the medical assistance from the medical doctors, which helps them understand it even more, because circumcision is very crucial. We must have that in order to lessen our chances for STIs, and it also enhances you as a man.
Interesting views there. Now, before we get entangled in that discussion about, which is best, traditional or medical, let's get a proper perspective of the rationale behind this tradition. And it's a pleasure to welcome our special guest today. First up is Dr. Laureen Boysens. Now, Dr. Boysens is Clinical Director of the SAC2 Worker Health Program. Welcome to Health Talk, Dr. Laureen.
Thank you, Dr. Cyril.
Right, and next to Dr. Boysens, we have Colin Bonetri, who is the director of the National Male Medical Circumcision, or MMC program, within the National Department of Health. Welcome to Health Talk, Bonetri.
Thank you very much. Thank you.
Okay, perhaps let's start with you, Dr. Boysens. We in my introduction, I mentioned the issue around the problem of HIV. Let's just get reminded, and if I may ask you to do that for us, what is the actual problem we're having now? We believe that the incidence is high in certain age groups. Just take us through that.
I think it's very important in this regard to distinguish between prevalence and incidence. Mm-hmm. So according to Statistics South Africa in mid-2015, and those were the latest estimates, the HIV infections in South Africa, people living with the disease, was estimated to be 6.19 million. And that's a fairly high figure compared to global statistics. In terms of incidence, this very much speaks to the number of new infections that would be diagnosed in usually a calendar year. And when we look at the trend in South Africa in terms of HIV incidence, it is actually quite reassuring, because the trend is decreasing, which means we are getting fewer infections every year compared to previous years.
But there's talk of vulnerable groups.
Sure.
And why is there concern with vulnerable groups, especially girls between 15 and 25?
So vulnerable groups would be the population groups that show a higher HIV incidence.
Yeah.
A higher likelihood of contracting the HIV virus. Mm-hmm. And these groups have been quite well defined in our country, and definitely need to enjoy additional support in terms of HIV prevention as well as treatment. Mm-hmm. These groups include children, particularly orphans, because by definition they are quite vulnerable. Like you've mentioned in the introduction, it also includes adolescent females. I would say adolescent groups for both genders, but particularly for females. And I think our biggest concern is the 15 to 24-year group, where we find that 25% of new HIV infections annually can be accounted for by this particular group.
Yeah.
In addition to this, we also need to consider what we describe as key populations. And key populations include specific demographic groups, such as sex workers, males having sex with males in certain geographical areas, as well as people who inject drugs.
All right. Let's come to you, Dr. Rabonetri. Now, your view in terms of, problems around HIV. I mean, obviously, perhaps let's focus on prevention strategies. There was talk the other year of producing colored condoms just to try and, get youth to try and use more condoms. But sadly, it's not working. What do you think are the problems?
In terms of condoms, it was quite surprising to us as a department, of course, to pick up that there is a decline. There is a reported decline by HSRC of the use of condoms within the youth sector. However, an investigation that followed, which was undertaken by Society for Medical Health, provided information that the young ones do not necessarily take favor with the choice condom, which is currently. the brand that we are providing in the public. So we have since moved now to introduce this new condom, which is the bus condom, which so far already is giving indications that they're warming up to it. It's quite exciting for them. That is it as far as condoms.
Yeah, it's just when you look at it, I mean, a 52% usage rate is rather worrying, isn't it so? But let's talking about prevention. We're told that, I mean, obviously that's why we, having this discussion today around circumcision, that MMC or male medical circumcision is one of the ways that we can prevent, the transmission of HIV. Your comment on that specifically with regards to what the department is planning?
Well, medical male circumcision is a service that has been recommended by WHO as well as the UNAIDS as one of the prevention measures against HIV. And that was following multiple randomized controlled trials across the world, and which of course gave the results that pointed to 60% reduction in the risk of acquiring HIV by males during sex. Now, WHO since recommended that about 14 countries in the southern African region to implement programs on MMC as a measure to add within or into the prevention basket of HIV.
Okay. Now, the department, we know that there are reports that, we've set ourselves a target to get 4.3 million South Africans going through this MMC by the end of this year, December 2016. Where are we in terms of that target? Are we likely to reach that target?
There is a good chance that we'll be able to reach the target.
So there's a good chance?
Good chance, and I'll give you reasons for why I'm saying that.
Yeah.
We have a target of 4.3 by the end of this year, but as by the end of March, we were sitting at cumulative performance over the years of just over 3 million, which says we are then left with about 1.3 to cover. We are now engaging on a very robust.
So let me get this straight now. We've covered 3 million over a period of 3 years.
4 years.
4 years. And we left with 1.3 million, and we only have about 6 months, roughly.
That's correct.
And how likely is
9
that?
months, rather, to say.
Yeah. So is that still?
No, we are likely to do. As I said, we are embarking on a very robust approach to doing so, given the experience that we acquired over the years. Okay. What we do now, we're moving very, very closely into new approaches like targeting targeted groups. For instance, we're talking groups like, churches, mines, and so on, where people are in groups.
All right.
We are moving into privatizing, or rather contracting out some of the services to our partners.
Okay, talk about contracting other services to our partners. We're going to come back to that and delve a little deeper. Let's just get from you very briefly in about 15 seconds. You, one of the service providers. Tell us a little bit about your organization.
So I am the Clinical Director of SABC Worker Health Program, and we are one of numerous implementing partners that provide the actual medical circumcision procedure. And we are assisted by the United States to assist Department of Health in their national program. There are also partners that focus on raising awareness amongst the public for the service and linking them to the actual service.
Okay. We're going to come back to that. Of course, we need to get a little deeper into this to understand. I believe that we have some tweets coming through, and there's about 4 of them now. The first is from Chizi, who says, Babenda tribe always include the health issues that I knew from my very young age. Mtina says, nowadays is for your own safety in this world full of viruses and diseases. Chezi says, I did medical and it felt safe. And Mutape says, think maybe in medical circumcision, where to take care of the procedure, then learn traditionally to be a man. Don Dada says, it is best, medical is best, but it depends on your religion or tradition or values. Very interesting views coming through. We just need to go for a quick commercial break. After the break, we discuss MMC as an adjunct solution to prevention of HIV. Please stay with us.
Shield Medical Scheme, we don't just talk health, we do health.
It's so good, nothing else can replace just your slightest embrace. And if you only would be my own for the rest of my days, I will whisper this phrase, my darling, c'est bon.
MedShield Medical Scheme doesn't just cover you when you're ill, we'll help you stay well.
This is the New Start Clinic in Tsakane. Every day, men of all ages visit this clinic to be medically circumcised. Managed by the Society for Family Health, New Start is South Africa's largest non-profit HIV prevention program, with clinics spread throughout the country. At each site, the circumcision surgery is performed free of charge, and each individual receives a medical checkup and an HIV test before being operated on. Today, Hloni Mahate is here to undergo the procedure. He has learned that being medically circumcised reduces his chances of contracting HIV by 60%.
My brother passed away in 2007 because of the illness. That loss was really painful because it was someone who I looked up to, and he was like my idol. So it kind of enlightened me that each ever step you take, you have to take precautions that are available for you to stay alive. So I was like, I'm gonna take the right precautions, and the first one is getting circumcised.
Before Hloni undergoes the procedure, he attends a group counseling session. Sifiso, a New Start clinic counselor, explains the surgery step by step.
I actually thought circumcision was like going into a surgery with the doctor. You're being cut, then after being cut, you go home. But then I got here. I was welcomed by young people, the young guys that work here, guys my age. They informed me on the procedure. We learned a lot of things that I wasn't aware of, especially in terms of the process of sexual intercourse, that you might get infected, not knowing that you get infected. Like, he showed us how to use the contraceptive, using a condom properly, because everyone can use it, but in a proper way so that you avoid infections or any accidents happening.
During the counseling session, myths like the misconception that medical male circumcision is a natural condom are dispelled.
Initially, from the group information, when they come in here, they need to thoroughly explain to them that the MMC, it actually protects you up to 60%. So it's not a complete protection that you do a circumcision, you will never contract HIV again. So you need to emphasize on that 60%. And that the condom will cover the 40%, making you to be 100% safe. So that is why we issue them the condoms.
Being medically circumcised doesn't also mean that you are immune to all the infections that are out there. So one who is circumcised has to continue using a condom.
The procedure involves a local anesthetic injection at the base of the penis to minimize pain. The foreskin is then removed.
After you've stopped the bleeding, then that's when you suture. After you suture, they put on a pressure bandage just to make sure that they control the bleeding. So basically that's about it. It's a procedure that takes about 15 minutes at maximum to finish.
After the operation, Hloni meets with the clinic's nurse. He is given painkillers and taught how to clean his wound. He will take 6 weeks to recover and is instructed to refrain from sexual activity during this period. During this time, he will regularly visit the New Start's clinic for checkups.
To me, it's more like a step that a man has to take in today's environment, in today's society. It's a step that you take as a man to show that you're responsible for yourself and your partner's life and everyone else's life around you.
All right, so male medical circumcision is said to be an effective tool for prevention of the spread of or contraction of HIV during unprotected sexual encounters. Now, our expert guests will enlighten us a little more on this. Dr. Boysens, if I may start with you. Just explain to us just how, I mean, what is the science behind, circumcision reducing the chances of transmission?
So, quite a number of research studies have found that there is a particular part of the organ during sexual intercourse that is the predominant site of entry for the virus. And it is that portion of the skin that is removed during the circumcision that is the vulnerable part. So by removing it, you are eliminating a major entry point for HIV into the body and thus HIV transmission. And that is how it affords the protective effect.
Okay. And we hear reports that, this reduces the risk by up to 60%. But I need to point out to you that, and I suppose we need to talk about these things because these are things that are out there. You come across discussion blogs and people making statements to the effect that, this MMC thing is just a waste of time. In fact, nobody has ever shown that, there's benefits and that people that promote MMC tend to ignore the studies that show the harm. Just your comment on that.
Well, I think it's important to take note that in the medical fraternity, we need to be able to reproduce our research results. So we would do more than just one research study, and we would look at all the research studies in an overview and look at the aggregate findings. And so if you're going to look at an isolated study where it was particularly designed in a way where it had a slight deviation in terms of findings.
Or some newspaper article for that matter.
Yes, or a newspaper article which is probably not as scientific. Then you will definitely be able to argue a case. I don't think that that's necessarily a valid argument because I think that what the medical fraternity does is that they undergo a peer review when they do research, where you look at all the relevant research studies and you come to an overarching decision or opinion on a particular topic. And definitely the World Health Organization, as well as the National Department of Health, adopts the convincing scientific evidence that circumcisions prevent HIV.
The National Department's view on the matter?
Well, based on the available scientific evidence, which it's all about the total removal of the foreskin. As already indicated that the foreskin harbors some type of cells which are very friendly to the HIV virus, and reported progress in terms of the rate of infection amongst men.
Okay, we apparently we have a caller on the line, Anonymous from MLO. Anonymous, welcome to Health Talk.
Hi, how are you, sir?
Good, how are you? Your comment or question, please?
I'm fine.
Your question?
No, for me it's a comment.
Yeah.
Yeah. So I just want to urge all the men that it's safe to do the circumcision because I was once involved with a lady who was positive because I'm circumcised and I believe that I was safe because I was involved with this lady for more than 2 years. But when I go to check my status, I find out I'm negative. So I'm urged them to go and circumcise. It's safe.
So let me understand this clearly. You believe you're negative or you
No, I went for tests for several times. Now it's been like more than 3 years.
But you do use condoms, don't you?
No, we're not using a condom with this positive lady.
I see. I think thank you very much for your comment, because it's a very important one that we definitely need to address. Let me direct it at you, Dr. Boysens.
Certainly. I think it's really crucial for everybody in South Africa to know that circumcision is an important adjunct to prevention, but it is not a standalone item. Because it only affords 60% risk reduction, it doesn't eliminate risk altogether. So the advice from National Department of Health and their supportive partners is that condoms must always be used, not only to afford a male 100% protection, but also considering that a circumcision doesn't afford a female partner protection against HIV, whereas condoms would do so.
This notion that, when you're circumcised, you have a natural condom is a lot of hogwash, to say the least.
Yes, I think scientifically that is inaccurate, and I think that is a dangerous viewpoint to have.
Yeah.
I think that you need to take all the modalities and use them appropriately to make sure that you're 100% risk-free.
Okay. Just stay there. Let's talk up other benefits. Are there any other benefits of MMC other than just a reduction of HIV transmission?
Well, yes, there definitely are a few benefits. I think the main ones include the fact that when a male is circumcised, he now also has a lower chance of contracting certain sexually transmitted infections and a lower chance of developing cancer of the penis, because the foreskin is the common site where such cancer could potentially develop. I think the benefit for a female sexual partner of a circumcised male is that she has a reduced risk of developing cervical cancer due to the human papillomavirus, which is the most common cause of cervical cancer in this country. I think one of the benefits that's often not mentioned is that this is a vital opportunity for males to actually be examined physically by a clinical staff member, and they can actually detect a disease that they may have been unaware of, and they can now access treatment for this disease, which serves to their benefit.
Mr. Bundich, just following on, discussion we had in the last segment, just about, the targets and so on. Clearly, there's a need to expand, the MMC program and make sure that as many people go through this as possible. So what is the department doing in that regard to, to increase the capacity? I know that you mentioned you partner with service providers like Dr. Boysens, but what else are you doing, in fact, to even encourage more youngsters to go through this?
What is happening actually is that in terms of the supply issues, we're doing relatively well. Capacity-wise, we can handle more numbers. Our key missing link now, or a weaker link, is about demand generation. Though we are doing very well at above-level communication perspective, print media, electronic media, communication, what is missing, what we find to be missing here is more a social mobilization context of it. More the foot soldiers, more the people who will get to go into face-to-face discussions with men, because our sense is that we have at this point, in a way, rounded up all the low-hanging fruits, men who are ready to take action.
Okay.
Now we have men
can I
who
ask you to just hold it there, because I'd like us to carry on this discussion, because there's issues around recruitment that I want us to address. But I believe we have another Anonymous from Bloemfontein on the right. Hello, Anonymous.
Hello, how are you?
Good, how are you?
Yeah, fine, thanks, man. I just want to ask, because I underwent the traditional circumcision, but the total foreskin was not removed. So I just want to know if will I carry a risk of contracting the diseases if maybe I don't use the protection?
Excellent question. Thank you very much for your question. We'll get the expert to answer it. Do you want to take it now before we go for a quick commercial break? Yeah, quickly.
I think if I understood the caller correctly, he was saying that it requires a full removal of the affected part of the foreskin that can lead to HIV transmission in order to be safe. And that is scientifically correct. You have to remove the full part of the foreskin.
Yeah, but he says that he's been through traditional circumcision, and he's worried that they didn't remove the entire foreskin. They only removed part of the foreskin. So he wants to know whether or not he's at risk of contracting HIV or not?
I definitely think that I would advise that any individual in this situation would seek the services of a healthcare provider, get a professional medical opinion, and to see if it is the case. And if it is the case, then there could be a revision circumcision procedure offered.
And continue using condoms anyway, isn't that so?
Absolutely.
All right. I believe we have more tweets coming through. We have about 5 of them. And someone out there says, honestly, there's no serious benefits in Malawi. We do it as culture and not seeking benefits. Oh, interesting. Portia Nogula says, prevention from getting HIV and STI infections. I suppose a positive one there. Tiro says, total no-no for me, because even if you are circumcised, you still can get HIV and AIDS. Mushabi says, what are the chances of a circumcised man, percentage-wise, getting HIV from an HIV-positive female? You'll answer that later. Black Japanese says, medical because it's safe and hygienic, I would suppose. All right. So how is this MMC performed? Well, this and more after the break. Please stay with us.
If we're talking health, then let's talk seriously.
It's a battleground. These political parties contest the Mangaung municipality. Who will it be?
Abolishing tenders. The people who are poor must be subsidized by those who are rich.
He was the leader of the ANC himself. He never said anything. He's raising all this because he's frustrated.
Corrupt avenues can be closed.
From the Central University of Technology in Free State, watch SABC 1 and 404 this Sunday at 6 p.m.
Did you go to heaven?
Kelvin is the one who created all this.
What are you fighting over? Us.
If there is 10 million in my account, it will be in the front page the next day.
Do you have 10 million?
Oh, Jesus, hold my hand. Hallelujah.
It's happening right here on Question Time today.
Monday to Thursday at 5:30 p.m. on the SABC News Channel.
Welcome back. We're talking medical male circumcision. And before we carry on with our discussion, I believe we have yet another anonymous caller, this time from Kempton Park. Welcome to Health Talk, Anonymous.
Thank you, Doctor.
Your comment or question, please.
Yeah. My question is, what exactly are the primary functions of the foreskin? Because it looks like most sexually transmitted infections happen because of it.
Because of it, okay. All right. Interesting question. Dr. Boysens?
So during the development of a male child, you don't have a complete anatomical structure for any part of the body. So the foreskin is very much seen as a remnant of one of the developing parts of the organ and isn't really believed to have a very definite function to the male. I think that the reason why the foreskin is so vulnerable to infections is because the body has certain specialized cells within that tissue that become anchor cells or entry sites for specific infections. And so I think that by removing the foreskin, you actually remove the infection risk. And because it doesn't serve a distinct purpose in terms of physiology, it would be a clever method to use to protect yourself.
Okay. Mr. Bonnet, let's talk around ethical issues now. Just now we're talking about, recruiting more males to go through the MMC program. Now the story is that some people actually do this for financial gain. You have MMC practices coming into some sort of arrangement with schools, via school principals to say, okay, Principal X from school Y, if you can bring your boys to come through to my practice, for every boy that comes through, I'll reward you with 5 rands or stuff. Can you comment on that, please? Is that ethical?
Totally unethical. It's unacceptable. The service is free of charge. We do not have reported incidents of such happening, but why it could be happening, it is totally against the norm. We oppose that in the strongest sense, and that will land those people in trouble if they could be found to be doing that, which I believe the principal should also be in the know, that doing this for personal gain, for financial gain, would be very, very wrong. But in terms of our programs as a component of the training, and also as a component of the kind of agreements that we go into with our partners, that is a very, strictly highlighted component to say we should not be found to be inducing or coercing clients to come do that. So it is not happening.
So my apologies for interjection there. A follow-up question that will be around consent. First of all, to say, at what age, who goes through MMC? Is there a minimum age? And if so, how do you handle the consent issues?
The program's priority focal group is 15 to 49. In other words, the primary focus is on the sexually active. However, in terms of making services accessible, we do not turn anybody away.
Right.
Now, coming to consent, in terms of the Children's Act, any child who is 15 or below should have a parent or a guardian signing consent for the child. For the 16 and the 17, that is just the age group between 18 and 15 now. For those children, they can sign consent, but they can do so in the presence of a guardian or a parent. Now, the 18-year-olds can give full consent by themselves.
Okay. Well, let's get it from the surgeon herself. What is your experience? What are the sort of age groups that come through for the procedure?
So generally we do find that younger males are very interested in the program. So we do see roughly 12 years to 18 years. And that would be almost your high school group, really accessing the service. But we also see adult males taking up this initiative. And I think it is because of the messaging that is out there, and it is because of the prioritization of that age group in this program. So it's definitely starting to show early signs of promise. We hardly ever get age groups under the 10 to 12 year category coming through for local anesthetic procedures as such.
Yeah.
I think they generally would access services in a hospital setting.
Yeah. Just by the way, on the cost issue, I know that there was talk that it's free of charge to the person that comes through, but obviously somebody has to pay for it. Who takes care of the cost issues? Do you want to respond to that?
Well, from the Department of Health point of view, we do have specific budget for MMC services in the country through conditional grants.
Yeah.
Yes, so we're covering all our costs for that.
So it's completely free to the person that's going to do it?
It's completely free to the person who comes through for service.
Let's
And our partners, of course, are funded by different agencies who are partners to the Department of Health, for instance, PEPFAR, Global Fund, and so on.
Okay.
But it's all about making the service free.
Okay. Let's welcome on the line Innocent from Johannesburg. Innocent, welcome.
Yeah, how are you?
Good, how are you, sir?
Yeah, so I want to make a comment here. About 4 years ago, I was dating a girl. So after 2 years later, she fell pregnant for me. Then along the line, we discovered that she's a HIV positive. So I said, okay, I will keep you by myself until after my baby. So after my baby, I went to test. I tested negative because I was circumcised during my young age, maybe when I was about 2 or 3 weeks.
Yeah.
So we're still living together now. I love the wife, I love my husband, and I love my son. So I still want to make a request for your advice for me. But I don't know what to do, but we are still using condom anyway.
So let me just get this clear. You've tested negative.
Yeah.
And she's tested positive.
Yes.
And you're still living together, and you want advice in that regard. Okay. All right. Thank you very much. Perhaps I believe we have another anonymous from Spinks. Do we have a caller on the line? No, we seem to have lost it. All right. Dr. Boysens?
So what I understood was that this gentleman was circumcised at a very early age, shortly after birth,
Correct.
and that his partner is positive. He's tested recently and he's still negative. I couldn't quite hear whether he actually uses condoms.
Yeah, he says he does, yeah.
Okay. So that's obviously advisable. The fact that he's circumcised together with condom use would protect him. I do know that there is a plan to roll out preventative medication for discordant couples, where the one partner is HIV positive and the other partner is HIV negative.
Yeah.
This has to be done in a very controlled manner, and certainly I wouldn't be the subject expert on this, but I know that this is in the pipeline for the country, and when it does become available, I would suggest that the gentleman finds out whether he is eligible for such treatment.
All right. And then we have another anonymous on the line from Springs that we lost earlier. Hello?
Yes, how are you?
Good, how are you, sir?
I'm a good doctor. Doctor, I grew up during those days when we didn't have access to circumcision.
Right.
We knew people who go for circumcision and developers and the baby people during those days. Now I'm 57 years old.
Yeah.
I just want to find out whether is it safe for me to do circumcision at my age.
Okay. Well, good question. Thank you very much. Dr. Boysens?
I think as long as you are healthy in general and you don't have any conditions that serve as a contraindication to circumcisions and healing appropriately.
What are those, by the way?
There are a few. Obviously, if you've got, for example, an active sexually transmitted infection that demonstrates lesions on the foreskin, you would not want to perform surgery until that's been adequately treated. So that's just one example. So if you're healthy, then I would still recommend that if you feel the desire to go for HIV, especially if you're sexually active, you should certainly pursue this.
You know, we didn't have time to just go over the procedure. I mean, obviously, we've described in the clip of, how it's done. And it's essentially painless. I mean, there's a small amount of pain with that small injection. Yes. Are there any complications?
Well, the complications, because circumcision is classified as minor surgery, the complications are minimal. We see a very, very low rates.
Yeah.
So the benefits of the procedure weighed against these very low risks really justify that people access the service.
All right.
There are some complications, but they're usually minor in nature, and they very much speak to compliance to medical advice in the aftercare of the wound.
All right. On that note, let me take this opportunity to thank you very much for your contribution, Dr. Laureen Boysens, Clinical Director, SACTU Worker Health Program. And we remain with Mr. Bonetri. We go for a quick commercial break. When we come back, we speak to the Deputy Minister of Traditional Affairs. Stay with us.
MedShield Medical Scheme, we don't just talk health, we do health.
The cotton field story is being told through patchwork by artists to celebrate the diaspora in America.
Vitally important in telling the stories of what is happening in the refugee crisis, migration, with questions of immigration, and I believe I, as an artist, have a moral obligation to tell these stories.
It's through paper, brush, and paint that the different faces of women are reflected by this prolific painter.
Women face a lot of challenges, discrimination, sexism, and a lot of other negative, In my paintings, I try to send a different message.
Place of the G-Men and Father Huddleston's mission. Place of Balanski's and the Odeon cinema, and let's never forget.
Join Refilwe for that 1 hour weekly dose of arts and entertainment news every Saturday at 12.
When we deal with initiation, it's a very secretive and respected culture. So initiates are not normally welcome or allowed to go to health facilities. Everything that you do, it must remain in the mountains. So the team of doctors, professional nurses, dietitians, forensic pathologists, we came together so that we assist.
Those that want to go to initiation school now, they must not be scared anymore, because we have a forum called Ingoma Forum.
The custodian of this culture is traditional leaders. That's where we need to start, and they are welcoming the intervention because they see the difference and they see the progress, and it does reduce the deaths and casualties in the initiation schools.
Our child are safe. They're on the right safe, on the right hands with us and the doctors.
Ukusebenzisana doctor. Support health yawa. Not to say mangithi health mhlambe la sikhona kusi right ku right. Abo doctor labo kunye bakhona ubona umunye umuntu makane problem nje thina maybe ngeke sakhona ukuyibona.
We are not taking the culture from them, but we are helping to reduce the death rate.
Gone are those days where initiates will be treated as if they are not human beings when they are in the mountains.
Nowadays, initiation school is not longer going to be a monster that people will run away and say they will die.
We still say 1/3 is too many for a person to lose their life while they are practicing their culture. So hence the Ingoma Forum tries to assist on a health perspective to make sure they arrive and come back safe.
So there are some people, the so-called traditionalists, who believe that the only way to be circumcised is to go to the mountains as a rite of passage into manhood. And the others, the so-called modernists, who believe that it is much safer to be circumcised by the hands of a Western medicine practitioner. So we're going to be talking about how MMC and traditional circumcision can be incorporated, mainly to make this practice a lot safer. But before that, I just need to, there's a tweet that came through that asked the question, you know, what are the chances percentage-wise of a man who's been circumcised to contract HIV from a HIV-positive woman? I think the issue, and this is what we've been discussing right through, is that if you're circumcised, your chances of contracting HIV are reduced by 60% as compared to if you're not circumcised. So that is the percentage. However, whether you're circumcised or you're not circumcised, it is still advisable that you always use protection. Do you want to comment, Mr. Bonnech?
Circumcision?
Yeah.
Plus consistent use of condoms confers 60% reduction in the risk.
Okay.
Not one on its own and the other, or sometimes, no, it should be.
All right. It's now my pleasure to welcome our special guest, Deputy Minister of Traditional Affairs in the South African government, Dr. Obed Babela. Welcome to Health Talk once again.
Thank you very much, Dr. Mtao.
You know, last year about the same time, I think it was around the 27th of June, thereabout, we just checked the dates, we had a discussion on this issue of traditional circumcision. And at that time, the death toll was standing at 6. Now, I believe before we started the show today, the death toll is now at 4.
It's 6.
6 again. All right. Where are we today as compared to where we were last year? Just to remind you, last year we spoke about, issues around policy and, formulating legislation to try and, kind of put this thing in order, as it were.
Yes, let me just start by saying from that 6 that we were reporting at the time of my interview last year, we then experienced throughout the year 101 deaths.
101?
That was 2015. And today I'm here, 6 deaths already recorded, 3 in the Eastern Cape, 2 in Mpumalanga, and 1 in Gauteng. So we're standing at 6. And quite a number of initiates have just gone in yesterday, because schools were closing yesterday in majority of schools. So the number next week is going to be a very difficult week for us as we go to check whether everything is being done correctly or not. The biggest area is the illegal schools. All the deaths that I'm reporting now are arising from illegal schools, schools that we didn't know that they exist. The Ngoma Forum in Mpumalanga, which has integrated health professionals, didn't know about the existence of those schools. In the Eastern Cape, the same thing. They die of dehydration. That could have been prevented if medical people were there. They knew that the body needed these fluids, water. And the other one died as of diabetic, means he went into school with diabetic conditions without being medically pre-screened, because the requirement for you to go to the traditional school, you must be pre-screened first, and then those who are running the schools must see the certificate from the doctor saying your health is clean.
Yeah.
And if any problem, then you are allowed to go in with whatever medication that you are taking, so that when you go through the procedure, indeed, the medication is low.
Yeah.
Therefore, the integration of doctors is very critical, and I think we are now talking to the traditional leaders that let us allow the graduates themselves, who are now health professionals, who had gone through the initiation passage, to be allowed in, and they're willingly and coming forward and say, embrace us, we want to help, so that we prevent death and we prevent incidences.
So what is the uptake on that issue, especially with the traditional healers? Because I mean, look, it's worrying that even at this stage we're sitting at the same death toll that we were sitting on last year about the same time, which says that something is definitely, something has to happen.
Where it has been integrated, there's been very less incidences, I must say. So in Limpopo, for example, is one good example province where there's been less and less deaths.
Right.
And Limpopo is able to register 0% of deaths, except last year 1 death occurred in an illegal school, because we didn't know, and no one knew about the existence of such a school. So it spoiled the record of Limpopo, which has embraced the health professionals who are there to help, and even helping in the surgical aspect of the circumcision itself. And then in Mpumalanga, it's coming and catching up, which is very good, but we'll then be testing Mpumalanga capacity next year when 40,000 initiates are moving in. This year is only 5,000, next year will be 40,000. So it means therefore the capacity and the number of the doctors that needs to move into Mpumalanga next year, we have to look at that, working with the health department and say. And then in the Eastern Cape, the resistance is a bit high, unfortunately. They only allow the doctor after the circumcision to come and look at the conditions from time to time. They don't allow them to be part of the procedure, and which is a most difficult area that we're still talking to traditional leaders really to embrace this modernity and then really save lives and ensure that we all adhere.
Well, saving lives, I'm sure that's what we all want. But it clearly can show, at least what from the discussions we've had today, that incorporation of MMC into the traditional circumcision tradition seems to be producing results, and it seems to be doing well. I suppose we just need to do more work in the Eastern Cape.
Yeah, we have to do more work there, because unfortunately it was spoiled by some doctors who do not know the culture, and they wanted to impose themselves on the traditional leaders, and traditional leaders resisted, unfortunately. Now we have to deal with the issue of trust now. And we are working on that particular trust. And once the trust is there, we'll be able then to see some success alone. But the law is also being, it's on the passage to go into Parliament. We're hoping that by next year's season, the law will be there to do away and criminalize all illegal schools, so that then those who are running them we wipe them out of the system and in existence.
Well,
in that way, we can then deal with only schools that are...
Okay. Unfortunately, we've run over our time. Deputy Minister Obed Bapela, in Traditional Affairs, thank you so much for your contribution as always. Let's just hope that at least going forward, MMC will make some sort of difference. And Colin Bonetri, from MMC, Director MMC National Program within the National Department of Health, thank you so much for your contribution as well. Well, folk, unfortunately, that's it for today. Remember to join us again next week, SABC News. A reminder to please share your views and comments with us via our Facebook page, SABC Health Talk, and on Twitter at SABC Health Talk. Remember that you can watch a repeat of today's show at 2 p.m. today and again on Thursday morning at 5 a.m. I'm Dr. Cyril Ramaphosa. Thank you so much for watching. Thank you for your calls. Thank you for your tweets. Goodbye, and please do take care.